Very high. That is how the Center for Disease Control classifies Tennessee in its level of respiratory illness activity. It's our top story tonight. Good evening. I'm Sarah Diamond.
And I'm Casey Marler. The CDC also lists Virginia as high in respiratory illnesses as the latest weekly report was announced. News Channel 11's Catherine Simpson found out today that cases, particularly flu cases, are rising fast, and what precautions we should be taking as schools in the region are preparing to start their second semester. Catherine?
Sarah, Casey, Ballad officials told me RSV levels are stabilizing, but we're not out of the cold and flu season woods yet. With infections this high, Ballad officials say it isn't too late to try and prevent illness.
I do believe we are right in the peak of our respiratory viral infection season.
Tennessee is one of 7 states reporting the Centers for Disease Control's highest level of flu activity. Ballad Health officials say flu cases are rising fast in our region. All Ballad facilities collected just over 1,750 positive flu tests last week. COVID-19 cases are climbing as well.
We're seeing more cases that are coming in through urgent cares and EDs, but also we're seeing a few more admissions in our facilities. So we really do expect those numbers to potentially continue to increase a little bit.
Ballad currently has 162 patients hospitalized for COVID-19. With people returning to school and work, Ballad Health's Jamie Swift says prevention is still the best cure for high infection rates.
It's not too late to get vaccine, and that's for children and adults. So the flu vaccine, certainly if you've not had it, it's time to go get it.
If you or your child is experiencing flu-like symptoms, coughing, chills, body aches, Swift says stay home.
Give those schools a call. If your child is sick, work with them. If they're having flu-like symptoms, let them know. We really want people to not go to work, not go to school, not go to all the places. If you're sick, it's important to stay home until you're fully recovered.
Swift says it's hard to predict, but cases will likely continue to rise over the next 2 to 3 weeks.
The thing to remember is even once we peak in those weeks that follow, it's still a lot of infections as we come off of that curve.
I asked Swift how long it takes for a flu vaccine to become effective. She told me you get a small amount of protection immediately and are fully protected about 2 weeks after. Sarah, Casey.
Catherine, thanks.